Good morning. As of today, we are reporting 76 new cases of COVID-19 in the state. This does include 6 new hospitalizations, 4 new deaths. All 4 of those deaths occurred among Minnehaha County residents, 114 new recovered individuals, and 259 new negative tests that have been performed. In total, we have 2,525 COVID-19 cases that have been reported as part of this pandemic. This does include 818 individuals that are actively infected, as well as 1,686 individuals who have recovered. 179 individuals have been hospitalized, and 21 individuals total now have died. 14,838 negative tests have been performed. The information for cases by county include 3 new cases in Brown, 3 in Day, 1 in Dewey, 1 in Hughes, 6 in Lincoln, 51 in Minnehaha, 1 in Pennington, 4 in Roberts, 1 in Stanley, 1 in Todd, 3 in Union, and 1 in Yankton. The information for cases by age range include 7 in the 0 to 19 year age category, 16 in the 20 to 29 year age category, 15 in the 30 to 39 year age category, 11 in the 40 to 49 year age category, 6 in the 50 to 59 year age category, 7 in the 60 to 69 year age category, 4 in the 70 to 79 year age category, and 10 in the 80 and over category. For the new cases by sex, we have 32 males and 44 females. I'll walk through our numbers the total deaths that have occurred within the South Dakota. We have 2 that have occurred in Beetle, 1 in Gerald, 1 in McCook, 16 in Minnehaha, and 1 in Pennington. The deaths by age range include 1 in the 40 to 49 year age category, 4 in the 50 to 59 year age category, 4 in the 60 to 69 year age category, 3 in the 70 to 79 year age category, and 9 in the 80 and over category. For deaths by sex, we have 15 who are male and 6 who are female.
Thank you, Dr. Clayton. I'm going to go ahead and open up the lines, and we'll take your questions.
Dr.
Beth
Clayton.
Gordon calling with Dakota News Now.
Go ahead, Beth.
Yes. Do you have all of the supplies needed to fully take and complete COVID tests for the 3,000 that you say are available to run?
Hi, Beth. This is Kim Olson-Rice, and we addressed this in the governor's press conference, so the information is not any different than what we talked about there. We do have the ability within the state to test up to 3,000 people per day, and so we have the needed supplies to do that.
And so what is the application process for talking to these clinics to know what supplies they have on hand to report that to you?
I'm sorry, can you repeat your question?
Yes, you say you've got the 3,000 test capability. What is the communication process with the various clinics and hospitals where they are reporting to you what they have on hand so you have that number?
So we have various ways that we understand the test capacity in the state. So we have regular communication from labs that are located in the state, as well as providers that are using outside labs. And so it's just, we've got regular communication channels happening. We also have weekly calls that are around supply chain management. That would be with supply chain managers of hospitals and other providers, as well as laboratory weekly calls. So a number of different ways.
Next question.
This is Mark from the Black Pioneer.
Go ahead, Mark.
So, Spearfish just opened up its businesses again with no restrictions. The city council is still providing guidance. Yesterday, lunch hour, dinner time, downtown was pretty packed, definitely not social distancing. What would you say to those people? And then secondly, is there a good rule of thumb as to, for every one person in South Dakota who is tested positive, X number likely have had COVID?
This is Kim. I guess to your first question, again, we're encouraging people to follow the governor's plan, and that does include taking responsibility, using social distancing, using good hygiene, disinfecting environments, wearing a mask if you're gonna be in public and at risk of being closer to people. And so that would be our advice to individuals, whether that's in Spearfish or any other community. Back to your second question, there is not a way to really predict, how many people based on the, actually have had COVID based on the number of people that are positive. However, as we have more antibody testing that is reliable, that will really help us answer some of those questions.
Next
Hi,
question.
Ray from Kellerland.
Go ahead, Ray.
Hi, yes. You've mentioned that we have the capacity to do up to 3,000 tests, possibly 5,000, but we're not there yet. How do we get there? I mean, how does this happen that we increase our testing so we can do 3,000 to even possibly 5,000? I know we have the tests, we have the capacity, but how are we going to get those folks tested?
So, Ray, I'll start and then ask Dr. Clayton to weigh in as well. We want to make sure that we're ready and that we have the testing capacity needed, and that is we're at that point now. But we're not going to waste those supplies and just test people because we have the testing supplies. The recommendations are still that testing happen for folks that have symptoms of COVID. Those symptoms have been updated by the CDC just this week, and so we did a formal communication with providers across the state, healthcare providers, ensuring that they understand what the criteria are and what the symptoms are for testing. And so we're ready when the need is there.
And I would add that one of the things that the change in the CDC symptom set for COVID-19 has allowed, I think, clinicians to do is to better align the symptoms that patients are experiencing when they're infected with COVID-19 so that they can direct testing appropriately. So I think you're going to see a transition here in terms of a little bit of who is being tested, but that focus is still on individuals who are showing symptoms. There is a benefit in very defined, limited settings of doing asymptomatic testing, but again, that is something that would be at the direction of either folks of us here at the State Public Health Department or through individual systems, such as being done for Good Samaritan Center and other long-term care facilities.
Next question.
This is Cap from the Rapid City Journal.
Let's go with the Rapid City Journal first.
Yes, Dr. Clayton, why would the number of negative tests for Pennington County actually decrease? We've had over 800 at one point, and today's total is only 725. Why would that number of negative cases ever go down?
Yeah, so I think the focus here is that, a lot of the testing that is being done does not always come to the Department of Health with the actual county of residence of individuals that have been tested. So what you see is in some of the locations where we have our larger hospital systems is that tests have been done there. It needs to be associated with some place in the state, and so when the patient county of residence is not available, it is initially located in the county in which the testing was performed. So as we have continued to do, the data are considered provisional, and we continue to clean that data on a daily basis, and that's why you do see some changes and fluctuations in those numbers.
Thank you.
I believe I heard the Argus leader. Lisa, if you go ahead.
Yep. Okay. The Brown County number of cases has increased by 10 since Wednesday, and just wondering if those are connected to Demcota and how many total cases now are connected to Demcota.
So what I can say is that we continue to work with the Demcota beef facility to help reduce any sort of risk among the employees there. We do have recurring discussions with them, and that we are, as of today, reporting 22 cases associated with the Demcota beef.
Okay.
Gordon Ritter, the Alcester Union Hudsonite?
The Alcester Union and Hudsonite?
Correct. Yes, I was on the call earlier with the governor, and I know the number of beds has been halved. What about that 300,000 to 600,000 South Dakotans expected to get the disease? Has that changed at all?
No. So the important thing to know just about what has happened around the overall anticipated bed capacity is that those numbers have been updated to reflect more information available really on the ground in places like New York in terms of what they're seeing for individuals who are showing symptoms and needing that advanced level of care that was required for hospitalization. The overall number of individuals who are infected in the state, we do still anticipate that we'll see somewhere between 30 and 70% of the population become infected with COVID-19 throughout the pandemic. The thing to keep in mind is that not all of those 30 to 70% of the population will go on to develop symptoms. So we do have a subset of about between 25 and 50% of the population that does not show symptoms when they are infected with COVID-19.
Final question.
Yes, JP from AOR News Radio.
JP?
Yes, regarding the increase in cases in Union County, is there any way to know if these cases would have been tied to the auto races that they had there on that one particular weekend? Even though there was nobody, spectators attending, could it be some of these people related to the cruise?
JP, that's not information that we have, and that's we have no reason to believe that the cases there are tied to the races.
Thank you.
As part of the investigation, that's not something that we've identified, and not something that we've seen.
Hey,
all right.
Could we just get a quick Smithfield breakdown?
Sure.
Thanks. I appreciate that.
As of today, we have 853 Smithfield employees that have been that have COVID-19 diagnosis, as well as 245 close contacts that are themselves become cases.
Thank you very much.
All right. Thank you all. Have a great weekend, and we will